In Privacy Watch, a new report suggests Google is secretly collecting the personal health records of millions of Americans. According to the Wall Street Journal, the tech company is working with a leading nonprofit health system that has facilities in 21 states. Dr. Tara Narula has the details.
The multi-billion-dollar healthcare industry has long been on the radar for tech behemoth Google, and now it's in it in a big way. As first reported in the Wall Street Journal, Ascension is sharing information with Google, a health system that includes over 2,600 hospitals and healthcare centers in 21 states. In the program called Project Nightingale, Ascension is reportedly providing patient names and dates of birth, as well as lab results, hospitalizations, and diagnoses to Google. Google is using the information, in part, to help Ascension centralize its patient database, as well as design new software that will use artificial intelligence to predict or identify medical conditions.
There are huge advantages to digital health information.
Pam Dixon is with the World Privacy Forum and says digital records are necessary. So is knowing exactly what companies are doing with such personal and private information and how they are protecting it.
Leaks of private medical information are enormously common. The Department of Health and Human Services actually tracks all of the medical data breaches, and actually some of the largest data breaches in history have been medical data breaches, so it is a significant concern.
In a press release, Google and Ascension say they are fully committed to a robust data security and protection effort, and fully compliant with HIPAA, the Health Insurance Portability Act of 1996, that protects patient privacy. Dixon says more has to be done.
But I do think that there is room for having an independent third party taking a look at what's happening at that health information that's at Google.
While Amazon and Apple are also trying to get a foothold in healthcare, Google has made the biggest strides so far. It has a previous deal with the Mayo Clinic, but in that case, any identifying information has been removed. Not so with Project Nightingale. Dr. Tara Narula, CBS News, New York.
For more, let's bring in CNET editor-at-large Ian Sherr. So, Ian, privacy experts say the way this data is being collected and shared is legal. What role does HIPAA play in this case?
In a lot of ways, it can be either the thing that slows everything down, or it can allow this all to happen. In a lot of cases, HIPAA, for example, will allow patient data to be shared with a company that helps a healthcare manager, like a hospital or an insurance company, do their job, right? Imagine external billing and all sorts of other stuff. One of the key things they brought up in this press release and this announcement from Google after the Wall Street Journal story was that they are not only centralizing their patient databases, but also creating new apps to help them do healthcare better. And in both those cases, HIPAA would pretty much be okay.
Well, the project aims to improve patient care, but the Wall Street Journal reports that the patients whose data is being used are not aware of it. So why do this in secret? Are there any major privacy concerns at play here?
Well, there's a couple of reasons that this probably happened in secret. One is probably that they're still in kind of the exploratory phase and trying to figure it all out. We don't have very many details about what's going on, but that's something to keep in mind. The tech industry, of course, is very historically secretive, which has not helped them very much with all of these concerns about privacy and their bad behavior. That secrecy has caused a lot of people just to feel uncomfortable with them. And, you know, I think what's going to be interesting to see is how this goes forward. You know, the tech industry in general wants our healthcare information. They desperately want it because they can learn a lot about us. They can not only create better profiles of who we are so they can advertise at us better and all of that, but also they think that they can actually bring some good. And they think that by building new apps that can look at the data and learn from it and point out things that maybe human beings didn't see, they could actually help us solve different diseases. And if they can do that, great, but they have to deal with these privacy concerns too.
Well, this is not the first time Google has tried to make a push into healthcare. 2 years ago, the tech giant, along with the University of Chicago, faced backlash over the mishandling of medical information after a medical center they had struck a deal with allegedly shared records with identifiable information. How is this time different?
In a lot of ways, it's hard to tell. You know, they made a point of saying this time around that they are following HIPAA. I imagine that, you know, to really know that, they would have to get sued and then a court would have to decide. But, you know, the couple of years ago, part of that was going on as well is that that was a more of a research-oriented thing. And there are different rules around that versus if Google was a vendor for this hospital. So it's a little in the weeds, but we'll see how this plays out. You know, the last case from a couple of years ago was trying to become a class action. I'm really curious to see how patient records get handled in the future and how courts will ultimately decide.
So this month, Google made public a deal with wearable fitness maker Fitbit. Some lawmakers have expressed concern that the deal would allow Google access to sensitive information of Fitbit users. Should we be wary about how much data some of these tech companies are able to collect from people, in some cases without notification?
Well, and that's the key, right? Not notifying people. And I think that's been the problem all along. They didn't notify us about this announcement from today until now, after the Wall Street Journal wrote about it. They didn't tell us about the University of Chicago until after it was written about. So this is a problem. The tech industry and this tendency to be secretive and to keep everything very quiet because they're worried about competition or whatever else is just not okay behavior. And it's causing them all sorts of heartache. And if they could help the healthcare industry, and if Google has something to offer, they should just be open and honest about it. But right now, they're not doing that.
We'll see if there's a move to transparency here in the years ahead. Ian Sherr. Ian, thank you very much.
Thanks for having me.